So hopefully the chat box works. I know in the past sometimes it hasn't. If the chat box isn't working, feel free to pop any questions in the Q&A box because I know that is working today. Yeah, any questions as we go through, just pop it in the Q&A and I'll come to it right at the end. And they can be questions on any part of medical application or interview, because that's roughly what we're going to be talking about today. So literally any questions you want to ask, that's fine. So a bit about SixMed, created by medical students for medical students, and we obviously have these surgery webinars, and then some more intensive UCAT BMAT support for those of you who haven't yet taken it, and then personal statement support and also interview prep. A little bit about me, I'm in my final year of medical school now. I study at the University of Manchester, but I'm based in Salford Hospital. I'm passionate about teaching and hope to go to med education when I'm qualified, and then I also have an interest in emergency and paediatric medicine, so it's a little bit about me. So what we're going to do today is talk a little bit about the medical school application and going forward what you can expect to happen, talk a little bit about how interviews work and what happens after interview, should things go well or not so well, and then there's a chance for a small Q&A at the end, but feel free to pop your questions in the chat as we go. Also, I hope you can all see my slides and hear me fine, so just let me know if you can't. You aren't able to talk through the session, and the session isn't actually massively interactive, so don't worry about putting answers in the chat box, but if you have questions, feel free to ask them as we go. You don't have to pop this in the chat if you don't want to, but just have a think about how confident you are currently feeling about medical school application and how much you know about what's going to happen next, and what's going to happen in the interview stage of med school application. We're just aiming to understand the process of applying to medical school and just address any general queries you have about medicine or the application process. Literally any questions you want to ask, it's a really good opportunity. There's not too many of you on the surgery today, so I'm happy to answer literally any questions you have about medicine. And like I said, I'm right at the end of my medical school career now, so I should be pretty well prepared to answer any questions you have. So, thinking about applications. So, for any of you who are applying, not this year, but the year after, this timeline is skipped straight to once you have sent in your UCAS application. So for any of you who haven't yet taken your UCAS and BMAT because you're applying in a year's time, you would have also done work experience, written your personal statement, taken your UCAS and BMAT exams, whichever you're choosing to do, and you will have sent in your UCAS application, and the deadline for that is usually the 15th of October. This is earlier than most other courses' deadlines, so just be aware of that it has now passed for this year, but for any of you who are applying next year, just be aware that it is early application just because you have to have your interviews, whereas other courses don't really interview as often. So yeah, you have to get your application in by the 15th. For your fifth choice can't be medicine, and you can come back and add or change your fifth choice at a later date, because that won't, whatever course that is, usually won't apply to the 15th deadline. So if you've chosen your 4 medical schools but you're not sure about your fifth choice, don't fret too much. You can change that at a later date or add that at a later date. So med school interviews, a lot of people ask when they'll start receiving their offers and having their interviews. It's really wide ranging between medical schools. Some people will get offers in early November and sit their interviews quite quickly. Others, it could be February or March before you even hear back from your medical schools offering an interview. So if it's getting to December time, don't worry, a lot of med schools don't interview before Christmas anyway, so basically don't fret. but some of you might get interviews as early as November. Usually interview outcomes are then in April. Again, this varies because we will talk a little bit about the outcome of interview, but some universities will give you an offer straight after you've done your interview. Some, it could be months after you've sat your interview, but generally interview outcomes should be out by April. That's pretty standard. And then in the May, June time, you will sit your A-levels and you get your A-level results in August, and then hopefully everything's gone right and you will start medical school in September. Med school starts a little earlier than some other courses as well. So thinking about how interviews work, so like we've already said, invitation to interview really varies between different universities. And so you could literally be getting an offer straight away, or they might keep you waiting for some while. Over COVID, Zoom interviews kind of became a thing. They were never really a thing before. And I think most universities now have tried to move back to face-to-face interviews, but still be aware that some may happen over Zoom. Face-to-face, to be honest, is a little easier, I think. It requires you to go for a day to the university and they run whatever the interview is during that day. I know Cambridge sometimes does it over a couple of days, and I assume Oxford does as well. And then if you are doing any over Zoom, just obviously make sure that you're in a quiet room, good internet connection, stuff like that. But the way they run will be similar. They will ask you exactly the same questions. It's just sort of, you know, a COVID safety thing, and it'll depend which university you go to. So why do universities use interview? You probably, as you go through your medical school application process, think, oh, UCAT, this doesn't make any sense. BMAT doesn't make any sense. Why are they making us do this? They're just making us jump through hoops for no reason. But interviews are really, really important because when you go into medicine, your personality is an important aspect of how good of a doctor you will be. And it lets universities assess whether you're going to be suitable for their specific course. It shouldn't be a shock to you that different universities prioritize different things. So some universities are very academic. They really want these sort of research doctors. And then other medical schools, so for example, Manchester, where I'm at, really care about the communication skills aspect of it and think being a good doctor is much more about how you can interact with people, how you interact with your team and your colleagues, as well as your patients. And so the different universities will be looking for slightly different things, but they're just assessing whether you would fit in well with their course and the rest of their cohort. But it also gives you an idea of whether you can see yourself being at that university. Interestingly, interviews do mirror CCAs or the practical exams at medical school quite a lot, and they will test you in a wide range of things from ethics to sort of role playing, and you will meet the interviewers who generally are medical students and teachers at that university, so you can just see yourself if you can feel that you fit in well there. And that's what personally happens for me. I went to Manchester's interview and really liked it there, and that sort of sealed the deal for me. So yeah, that's really the purpose of the interview. In terms of when you approach your interviews, it's just important to be really confident, really sort of secure in yourself, and remember that interview isn't to test knowledge at all. It's really to test your personality and try and let that shine through. Don't overthink, you know, prepping, especially like anything scientific. They really don't care. And they're not going to test you on anything medical. They're not expecting you to be ready-made doctors before you get there. So don't stress about anything like that. But when you approach an interview, it's really important that you're confident and just try and get them to see your communication skills. So there's 3 types of interview that you might get. So first is traditional panel. Now this is really mainly seen at Oxbridge University, although I think some others do traditional panel. And actually now traditional panel has kind of changed to slowly move towards multiple mini interview style anyway. But what you get with traditional panel is usually a set of about 3 interviewers sat across the table from you, and you ask different questions, and the interviewers stay the same throughout most of those stations you're given. Just because of the types of university that use traditional panels, sometimes they are slightly more scientific and include maths and science stations and logic stations a little more commonly than the types do. But they will also include those ethics stations, and they can also include sort of like the out of the box stations. So things like interpreting a piece of artwork or etc., those types of things. But traditional panel is not super used anymore, but yeah, it's better for any of you who are like warm up to people as time goes by. There's pros and cons to all these different types, but traditional panel, if you warm up and get more comfortable sitting in the same scenario for a longer period of time, then you might do slightly better at a traditional panel interview. But yeah, not many places use them anymore. MMIs, or multiple mini interviews, are the most commonly used interview type these days. They're used by almost all of the medical schools. And what these are usually stations just slightly under 10 minutes long each. And you do, 9 or 10 different stations, and they each focus on a slightly different topic of medicine. So one would be a pure ethics station, one might be a Breaking Bad news station, one might be a maths station, one might be a bit of a strange station. And you just cycle through those stations one after each other. And yeah, they're just more commonly used now because they're arguably a bit fairer than traditional panel interviews, because if you muck one up, you can move on to the next station, and your new interviewer has no clue what you've said in your previous station. So each question is marked completely independently. And yeah, so the main tip for doing a multiple mini interview is, if you do mess up, just move on and try and put it behind you and not let that affect your future performance. Because I tell you, when I applied to medicine, I completely mucked up one station in MMI, and I still got an offer at the end of it, and I really badly mucked up that station. So these are a really positive thing, and but they are quite tiring, moving through the different stations. These also mirror what practical exams at medical school are like. It's almost identical to what you will be doing. But yeah, and then group interview is like really rare these days. I think it was more common when I applied to medical school, but they're not used that much anymore. You will typically see them as part of an MMI usually. I think usually you have to do a group interview and then go into an MMI. And typically they're seen in more PBL-based universities, and they usually ask you to do a PBL case and see how you interact within a group, see whether you're a good team player, your confidence, etc. But they're not used that much anymore. But just be aware that they might come up. I'm not sure whether anywhere still uses them. I know Hull York used to, but I'm not sure where it does now. The other thing with group interview as well is you will never just have a group interview. It will be a group interview and then one of the other types as well. So interview results. So you can get the outcome of your interview anytime after you've sat the interview. Manchester gave me an offer within a week of sitting that interview. And then I think Sheffield, when I applied to Sheffield, they gave me an offer like 3 or 4 months after I sat the interview. So it really depends on the university, how they do things, how they mark interviews. And your sort of outcome from your interview can either be accepted, rejected, or waitlisted. So what can happen is you sit your interview, and then a week later, a couple of weeks later, you automatically get accepted. That just means you did really well in your interview. They really liked you. They really saw that you fit well with them. And so they automatically gave you an offer. If you didn't do so well and they automatically know that you probably, you're below a certain threshold and they don't think you'll be a good fit, they might automatically reject you. So you'll hear within a week or two, you've been rejected, but then most people will be waitlisted. So what this means is, I think it's like 50% of people who sat the interview get put on a wait list. And at the end of all the interviews, they then decide who of those people will get an offer. So if you've waited a long time, it might be that you're just on the wait list. It doesn't mean that you did badly. They usually only accept and reject a very small proportion of people straight away, and they usually just wait for all of their interviews to finish to sort the waitlisted individuals out. And just because you're waitlisted doesn't mean you're not going to get an offer. A lot of people put on a wait list will still get an offer. So that's sort of the outcomes. You rarely are told you're on a wait list, so you can kind of just assume you're on a wait list if you've waited a long time. But then eventually they will let you know whether you've been accepted or rejected. After you've got all your offers back, or if you've only got one or two, but that those are your top choices, then you can choose a firm and a second choice on UCAS. So firm choice on UCAS means that's your top choice, that's where you want to go. And once you've sat your A-levels, if you get the grades, you'll automatically get that place there. And then usually your second choice, also sometimes called your insurance choice, usually should be have like a lower grade condition. So if you've chosen a medical school that needs A-star AA, then your second choice should really be a place that has offered you a 3A condition, for example. And then if you don't get the grades to get into your firm choice, you'll automatically get your second choice, providing you got the grades for them. So that's all that's saying. If usually people will put their firm as a medical school and the second choice as their sort of fifth application. So if they chose biomed science, for example, you can choose 2 medical schools if you want. You can choose 2 medical schools that have given you the same grade offers if you want. It's completely up to you, although that's not really going to benefit you at all. There has in the past been some sort of speculation as to whether if you choose a medical school as a firm or insurance, then when you go into clearing, they might prefer you to a different candidate, but I don't really think that has any weight. So I would recommend putting the firm as your top choice medical school, and then your second choice as just any of your offers that have a lower grade offering. And then if your top choices come in and you're still waiting to hear back from other medical schools and you're not interested, you can actually just withdraw if you want to. That's what I decided to do when I applied. I'd heard back from my top choice and I didn't want to sit interview at one of my other choices because I already knew that their offer wouldn't make any difference to me. So I decided to withdraw. So what happens after interview? So then you sit your A-levels. Some of you might have previously sat your A-levels. Some of you might also have degrees, but most of you will still need to sit your A-levels. You don't get unconditional medical offers. They all have a grade condition on them. So you must achieve the A-level results that they ask of you to get in. The only sort of caveat to that is if you've already sat your A-levels, then obviously your offer might be unconditional, but that's because you've already got the grades. You need to focus on doing well in your A-levels. There's no point getting the offers from medical schools if you then don't get your A-level results that you need on A-level results day. So you need to just try your best on the exam day and make sure you've focused hard, revised well on your A-levels. And then have a backup plan for if you don't do well in A-levels. Most of you will get an offer from medical schools, but just make sure that you're getting the grades you need as well, because you don't want to be let down at the last hurdle. Backup plans for if you don't get into medicine. Clearing is available at some medical schools, less so now than it used to be, just because of the backlog from COVID. So they don't have as many, like most medical schools will be completely full on their courses. So I'm not sure clearing, you don't rely on it at all because you're not guaranteed anything with medical clearing. Feel free to go into clearing for a different subject. If you want to just go on to do biomed, they will absolutely go into clearing. Nursing always goes into clearing, but don't rely on getting into a medical school through clearing. A lot of people will decide to take a year out and either rework on their A-level subjects or reapply, a year later. That's usually the two main backup plans. It's also worth knowing as well, there are now other degrees which are similar to medicine that you could do. So for example, a physician's associate degree. So you could go and do biomedical sciences for 3 years or a different science, sort of biological science degree. And then following that, you could do an extra 2 years and become a physician's associate. And ultimately, they have a very similar job to junior doctors. There's just not that much progression after that. So you just pretty much stay working as a junior doctor. You're also not known as a doctor, but if you're interested in the job, that's a good option because you will be doing a job very similar to medicine. So if you succeed, well done, then you're on your way to studying medicine. On the day of results day, check UCAS and they should let you know whether your place has been confirmed or not. Quite often people's places get confirmed before the results are released. That's just because universities get your results a day before you do, so that they can plan how many students they're going to have for that coming year. So UCAS is sometimes updated before you actually get your results. So keep checking UCAS, and on the same day as results day, you should notice that your firm or insurance, whatever grades you've met, that should let you know that it's confirmed, your place is confirmed. You will then receive an email from that university letting you know that they know that you've been confirmed and giving you information on things like applying for accommodation and things like starting dates as well. You'll hear from your university within usually a couple of weeks of results day. It's very quick, the time between results day and starting medical school. It will absolutely fly by. So try your best to enjoy your summer before results day, because after results day, there'll be this mad panic of buying everything you need for university, and then you'll be off. If you don't get the grades you're hoping for, you can try clearing. If you're thinking you might need to go into clearing, it's worth just writing down the numbers of the clearing hotlines that you're going to be ringing beforehand, because clearing is very busy. People ring it straight after getting results, so you need to get in there as quickly as possible, and then consider resitting A-levels, or whatever the aspect of your application that's let you down, whether that was your application tests or whether that was your interview, whatever it was. Think about redoing them, and you can reapply later. You can also go and do a different degree and move on, like I've already told you. So what to do before starting medical school? This is like really, really important information. Do prepare for moving out of home. Most of you will move away from home. Some of you might move quite far away from home. And I do recommend not living at home if you can do. It's a really good experience, and as a doctor, it will be difficult for you to, stay living at home. So it's good to get it out of the way earlier rather than later, learning how to do everything by yourself. But prepare for moving out of home. Spend loads of time with your friends and family, because you're going to be quite stressed and very busy when you first come to medical school. I know a lot of people say the hard part is getting into medical school, but medical school itself is not an easy ride. And so make the most of just having no responsibilities, having your exams finished and no revision to do. And just see your friends and family as much as you can. And relax and go on holiday, and just try not to think about results day. What's done is done, and you can just move on. And when results day comes, then you can worry about whatever the outcome is. So just try your best to relax and not do anything. It'll be the first time in a few years that you really don't have anything to do in your life. So enjoy that feeling, because once you start medical school, that feeling's gone. You will then have exams for the next 5 or 6 years of medical school, and then the next 10 years of being a doctor as well. So really do enjoy your holiday. Don't try to start studying the subject. It's absolutely pointless. I hear so many people ask, what should I do before I start medical school? What revision can I do? It really doesn't matter. I wouldn't do any, because each medical school has a slightly different curriculum and they're not expecting you to know stuff before you come to medical school. And I'll tell you, you probably won't start knowing a whole lot of stuff until you're in your 3rd or 4th year anyway, so don't worry about getting a head start. The work in 1st and 2nd year of medical school is pretty manageable, so don't try and pre-study, there's no point. You're just going to ruin your holiday. I don't recommend buying textbooks. I don't think many people do buy textbooks anymore. They're really expensive and they're not super useful. I bought textbooks before I started medical school. I've used them like 2 times. You can use the books available in your medical school's library. And most people just use the internet now anyway. And don't panic about moving out. It's a really exciting time. You're going to meet loads of new people who are in exactly the same boat as you are. Yeah, it's just really fun, really exciting, and a brand new chapter. It's not something to worry about. Naturally, you feel nervous, but you're going to be absolutely fine. So don't worry too much. Just basically enjoy that summer. And yeah, if you don't succeed, like I said, just prepare a few days before results day about going into clearing. Some universities will say, we haven't had enough applications for this specific course, so we will definitely be going into clearing. You know, you can look at who has previously gone into clearing and just make a list of the contact details of those clearing lines. Each university has their own clearing line. And if you're not going to go into clearing and you're going to take a year out, or think about reapplying to medicine in the future, then ask universities for feedback on what part of your application they didn't like. They are meant to tell you. Some universities are a bit dodgy about it, but you can ask for the feedback you were given in your interview. So you could see, oh, okay, so I failed all the ethics stations, for example. So I know I need to work on that next time. And then also just think about, you know, you'll know whether or not your UCAT or BMAT wasn't up to scratch. And so you just think about what aspects you need to improve on. And then work on those feedbacks, revise really hard, but also remember to work on the bits you did well in as well, because you don't want to sort of completely flip over where you start doing better on the bits you weren't good at, but have neglected those bits you were okay on. And then think about reapplying the next year. Save up some money for when you do start medical school. It's expensive and a lot of people struggle to work through medical school. So save up some money, do lots of work experience, go work in a GP, for example, even if you're just on reception or, you know, volunteer at a care home. You've then got this opportunity for a year where you can actually do so much work experience. So just prepare and really strengthen your application for the next year. So I hope that all makes sense. If you've got any questions, put them in the Q&A. I will just say now, people ask me quite a lot, how do you start revising for interview? And what I would recommend you do is make a list of all the things that you need to revise, like actually learn and revise. This mostly is ethical because that's where majority of the new information is going to be for you guys. Make sure you know about the 4 pillars of medical ethics and how to apply them to an ethical scenario. Make sure you know about confidentiality and consent and capacity. Make sure you know about professionalism, and try and read, there's a document called the GMC Tomorrow's Doctors. And that outlines what professionalism means as a medical student. So it's worth reading that to get a good idea of what they're expecting you to say about professionalism. And just keep up to date with today's current affairs in medicine as well, because sometimes there are current affair stations in your interviews, and at the moment actually there's a lot of very interesting things going on in medicine that you should be aware of, a lot of ethical issues that have been happening. So relatively recently, there was a young boy who he was on life support. I think he was 13 years old. He was on life support, and the doctors ultimately determined that he needed to be taken off life support because his quality of life, it's very complicated, but basically his quality of life was never going to be good enough. He wasn't going to survive, and his parents ended up taking the doctors to court because they didn't agree with the decision that was made. So that's an interesting one. I can't remember the young man's name, unfortunately, but there's been a lot of cases along those lines, such as Charlie Gard and Alfie Evans, you should be aware of. Junior doctors' strikes, you should be aware of that they are going to happen. They're currently balloting for strikes. You need to know why junior doctors are going to be striking, and you should be aware that in 2015 there was a couple of junior doctor strikes as well, and why they happened. I'm trying to think if there's anything else you need to be aware of. Obviously, COVID and waiting lists as well, they can all come up. And then I would just get a list of questions off the internet, like common interview questions, and think about how you would answer them, even if it's just like making bullet points on the points you would include, and then just practice saying the answers to family and friends. If you've got any friends who are also applying to medicine, do it together and get some feedback on how slick you were, how well you answered the questions, and do it in a timed manner so you know that you would be able to answer the question within time. I mean, there's questions that always come up, so you should be aware of how to answer those, like why do you want to do medicine? Why not nursing? Why do you like this university in particular? Those kind of questions you should be aware of before you go to those interviews. So that's really how I would approach interview technique, revision technique. Okay, so I'm going to answer some of your questions and some questions in the Q&A box now. If you have any more questions, please continue to pop them in the Q&A box. Do I know which uni start interviews early? No, not really. They kind of change every year, and also most unis, they do start interviewing early, but some of them spread their interviews out more than others. So you might not hear back from the university. I think when I applied, I didn't hear back from Liverpool till well after I got my offers from my other ones. And it didn't disadvantage me. I still got an offer from Liverpool, but they just interviewed me really late on for some reason. I think I was interviewed in March or something, and I hadn't heard back from them. So it's really just an annoying waiting game, unfortunately. You won't know until you hear back. And you can hear that your friends have been given offers and things and not heard back, but that doesn't mean that you're not going to get an offer from them, basically. But I'm sure if you go on places like Student Room, they will have done some sort of research on which universities tend to spread out and which don't. How were my interviews? Were the stations that you were unprepared for? How did you structure answers? My interviews were okay, to be honest. I did relatively well. I got offers from everywhere I interviewed at. And there were stations that I was unprepared for. So a lot of universities, like the examples that I can give are, one place asked me to play the game 21 questions. So you had to ask 21 questions and determine what object that person was. And my interviewer was a rose bush. And to be fair, I got pretty close. I got to a bush with flowers on. So I was pretty close. But that was a bit of a shock for me because I'd never heard of that station before. It's all about staying calm under pressure, because you've got to think, like, when you are a doctor and a senior medical student, you will be put into real life scenarios where you're asked to do things you're not comfortable or not prepared for, and you have to stay calm and, you know, stay professional. So don't be thrown if you do see a station that you're not familiar with. But yeah, just try and apply any techniques you've used. So like good communication skills, staying calm, being confident, and just think logically, and then that's how you attack them, really. I also had other stations like, this is a real life patient who has cancer, talk to them about their cancer, things like this that were kind of a shock as well. But you just have to, if you know your basics, then you'll be okay. So for example, if it's an ethics station that you've not prepared for, if you know your basic ethics, you should still be okay with the questions. But the other thing I will say, which I forgot to mention, was some universities let you know what some of their stations are going to be. So I know Sheffield used to say these are like 3 stations and these are the questions you're going to be asked. If they say that, like, and they say, you know, you must read this article or whatever, do that, because it's definitely going to come up. And then structuring your answers, just like do it logically. That's the best way I can say it. If you're asked to approach an ethics scenario, use a pro and a con, and then if they've asked you to come up with a solution, you must not sit on the fence, you must actually give an answer. So if they say, for example, you've given a nurse a prescription and she's gone to give the patient the medication, and then you realize you've written the prescription wrong, how would you approach the situation? Then you need to say, so if I was to follow the nurse, that would be good because it would stop the patient being put in danger because a wrong prescription is being made and we could intercept it. But also it might undermine the patient's trust in the medical profession, but I still think it's more important to intercept that prescription because ultimately patient safety is being compromised there. I hope that makes sense, but you need a sort of a positive and negative, and then a decision to be made. But that's the best way to structure answers. And then also just be careful not to be rude or like judgmental, I suppose. If you're asked to do a role play, don't laugh if they say something like, oh, I drink a whole bottle of vodka a day. People do that in real life. You can't laugh at real patients. Just be mature and don't assume things as well. So if a question says a nurse, don't automatically say she, because that is sexist. Stuff like that, just be aware of. And then, yeah, the more you practice, the more it will become naturally to you and you'll be able to structure answers better. But really, in the time of actually answering the questions in the interview, you don't have a lot of time to think, okay, this is how I would approach it. You kind of just have to jump in. So the more practice you do, the better you'll ultimately get. What's the difference between conditional and contextual offers? So conditional just means when you are given an offer, there are conditions on it. So it might say you must get 3 A's at A level. That is a condition. Others have other conditions too. So I'm trying to think of, so it might say 3 A's plus you must not have a criminal record, something like this. Like medical school ones do have a few conditions on them. That's what a conditional offer is. Contextual offers are ultimately, what is meant by that is when a university is looking at your application, maybe you've missed the cutoff to get to interview. Maybe your UCAT wasn't high enough. So they've done an automatic cutoff and given a certain number of interviews out. They will then look at the people they're going to reject and just check if that person's from a disadvantaged background, that person has a very strong application in other areas. They look at these kind of things, and then they might give you an interview offer based off that. That's called a contextual offer. So they've looked contextually at your application and then given you an offer based on that. So it ultimately just means they were going to reject you, but when they looked at you as a whole, for some reason they might have chosen to give you an offer instead. But conditional offers is like at the end, once they've given you your official offer, you just need to meet some conditions. In other courses you can get unconditional, which means as long as you pass your A levels, you still get to go there, but medicine doesn't have that. Does clearing exist for medicine? Yes, I know people who got into medicine through clearing. It's just not very common anymore. It used to be when I applied, because that was well before COVID even existed, and there was a push at the time to get more doctors. So they were like increasing the number of places at medical school around the time that I applied. They did increase it then again after a couple of years after I applied, but because of COVID, what happened was teachers were giving people's A-level results based on like their predicted grades. And so more people were getting the grades they needed for medicine than would have actually got the grades they needed. And so what happened was too many people were going to go to university. So they had to defer a few people's places because the government had put a cap on the number of medical students that are allowed to be in the country at any one point, just so we don't get flooded with doctors, because you don't want people training to be doctors who then don't have jobs at the end of it. So then they had to like give people places for like the coming years instead of the year they applied for. So then what happened was there were in theory fewer places for medicine each year. So places get filled up much quicker now. So clearing doesn't happen as commonly now than it used to, but it still does happen. It just depends on how harsh universities are being. They tend to not like to do it because medicine is quite a hard degree, and they kind of argue that you should be at a certain standard, but you know, things happen and people fail exams and people don't do as well as they'd hoped, and so they do offer it, but yeah, it's kind of not as common now as it used to be. For clearing, if I was to call a university, if they had any place and they said yes, would I need to only meet their grade requirements as well as BMAT, UCAT minimum scores? So it's kind of complicated and it varies between different universities. So you don't need to meet their grade requirements and you don't need to meet their BMAT and UCAT minimum scores in theory. They will have like a minimum that they want through clearing because they can't really just give a place to anyone. And like I said before, there are theories that they prefer people they've given offers to, but it sort of varies between universities. Just if I would only recommend doing clearing for medicine if you've only just narrowly missed out at one point of the process. I would, if you quite badly missed out, I wouldn't consider clearing. I would think about resitting and reapplying the next year. But basically it just varies between universities, and like I said, clearing doesn't happen that often now for medicine, so it's probably very competitive, to be honest. Yeah, Archie Battersby, that was the name of the guy, the young boy whose life support was turned off. Thank you for reminding me. I get confused because it sounds similar to me to Alfie Evans, which was the other boy. So yeah, Archie Battersby, read that case, it's very interesting and you should be aware of the ethics behind it. All my uni choices and BMAT UCAT scores. So I applied to Manchester, which was my top choice, which is obviously where I study now. Liverpool was my second choice and Sheffield was my third choice. I got offers for all three of those. And then I also applied to Nottingham, which I didn't get an offer for. I didn't even interview there because I hadn't heard back from them by the time I'd got offers from my other places. And then my fifth choice was Manchester Biomed. And I didn't sit BMAT because they were all UCAT universities. I did very well on my UCAT, so I ultimately decided not to sit BMAT and to change my choices to pure UCAT unis. And then my UCAT score was, I can't remember exactly, but it was, let me just figure out 1 second. 2,920, around there, was about that. Which when I sat UCAT, it was called UK CAT at the time, I was in the top 10%. I think UCAT now is a little bit more competitive. So I don't know where it would have sat now. How much does GCSE results matter? In my experience, not actually that much. I know some universities do prioritise it more than others, but ultimately your UCAT and BMAT results matter a lot more. GCSEs are really only considered in contextual offers in my experience. I do know some places do look at them. I know Manchester doesn't really look at them, but generally they do have to be pretty strong. They only look at the top 8, I think, though. So as long as your top 8 are good, you're probably okay. And those top 8 need to include your sciences and your maths and English as well. But if you've not done great in GCSE, I wouldn't worry. As long as you just haven't failed a load of GCSEs, then you'll probably be okay. Where can you get work experience? I recommend GP practices, especially if you're in a rural area and your GP isn't associated with a university, because they can quite easily take students, and you might struggle getting into hospitals for various reasons. One is COVID, although COVID's kind of starting to pass now. Places, we don't have to wear a mask in hospitals or things anymore. So they might be better now for offering work experience, but also there are other hurdles to jump through, such as your age, when it comes to hospital work experience. So GPs just tend to be better. And also it's just a better experience, honestly, being with a GP, because you can ask them loads of questions, whereas hospital doctors, they're usually a bit busier. Also volunteer literally anywhere. Volunteer teaching, volunteer in a care home, volunteer in a charity shop. All those things will teach you really useful skills that you can include in your personal statement and interview. So I really recommend volunteering. A lot of people volunteered in vaccination sites through COVID, so that's an option as well. What year did I apply? I started medical school in September 2018. So I applied, I think that makes my application year 2017/2018. I can't remember exactly, but I applied in I started medical school in 2018, so I hope that answers your question. What kind of questions come up in an ethics station? Like, so many different types, but they can be anything from like a pure ethics question, like those typical, if you had one liver to transplant and 5 different people, which of these people would you give the transplant to? So those kind of questions. But it can also be a lot of professionalism questions come up. So things like, you are a medical student on placement and you're working with a doctor and you smell alcohol in their breath, what would you do? That kind of question comes up quite a lot. And then the other type that I saw come up a lot was like linking it to current events. So I remember being asked in mine something like, this many people end up in hospital with alcohol related injuries. How would you reduce this number? And you had to talk about things like, would increase the funding for mental health and addiction and services, etc. So those are kind of the 3 types of ethics question that come up. But yeah, they're usually pretty basic, and you can usually tell what they're wanting you to say. When it comes to ethics questions, just make sure that when you are like learning about ethics and then answering these questions, that you answer them based on the right ethical answer, not on your opinion necessarily. You can include your opinion, but for example, if because of a religion or a personal belief, you don't believe abortion is correct, be aware that in this country, abortion is allowed and has to be performed if someone wants it. It doesn't have to be performed by yourself, but be aware, for example, that you can't say things like abortion is a sin or drugs are a sin. These kind of things, you can't say those, because in this country, what is taught ethically doesn't align with that. So just be aware that not to be over judgmental, and be aware that there is technically a right answer, and you can say this is an ambiguous situation, but the right answer as written in law and ethics in this country would be this. So just be aware of that. It just sort of reminded me. Should I do an EPQ? So EPQ is not going to change your grade offers for medicine. So in other courses it does. If you do well in an EPQ, sometimes they drop a grade. That doesn't happen in medicine because EPQ isn't offered at every school, and because of that, there are issues with medical school like quotas, and medical school is meant to have like a really wide range of students. It's not meant to be elitist, basically. So they rarely look at EPQ in terms of grades and offers. Okay, someone said it's considered by Lancaster, so maybe it is. But if you are very interested in a specific area of medicine, then you can do your EPQ in that area and talk about it in your personal statement and an interview. So you can only use it as showing interest in the subject, but don't expect it to be part of your offer. So a lot of medical students choose not to do EPQ. But if you're very interested in something, then feel free to do it. It's just better for you to do better in like UCAT, BMAT, and your A levels. So as long as it's not going to impact on any of those, then feel free to do it. If you make it to the interview stage, is your offer then based on that only, or they still take everything into account on the final stages? So it depends between universities. I've done work with Manchester. I did my elective in medical education, and so I know about how their sort of process works, but it will differ between universities. But I know they almost purely take into account interview and don't look at anything else, because they've kind of seen it like they considered that at the first point, so you've already made it past that point, so they don't need to reconsider it. The only time they then reconsider is if you and another student score the same, but they don't have enough places to give you both a place. Then they go back and look at everything and look at who's the strongest student overall. But if you get an interview, usually your UCAT was fine and it's not going to affect you. But it's just if you're on a borderline when you come to interview. Also, people sometimes ask like how competitive it is. Like if you get an interview, does that mean you're almost guaranteed a place? And usually what it is overall, it's 10 applicants per place for medical school. And an interview, only 50% of people interviewed will get an offer. So when you get to interview, you have a 1 in 2 chance of getting an offer, just for anyone who's interested, because I get asked that a lot. How stressful was first year of medicine and how did you manage it? I personally didn't find it that stressful. Manchester is a PBL university, so that means very flexible in terms of what you want to do. So there was lots of opportunities. We were very heavily encouraged to join societies, etc., and sort of have a work-life balance. So it was flexible, I find. I wish I'd worked harder in first year actually, but it was manageable, and they know that you're trying to find your feet in terms of like living in a new place, meeting new people. But just be careful, because the thing with medicine is it's not finite. You could do 24/7 medicine and still not be an expert. You know, you're not expected to be an expert in medicine to, or like a consultant. So you can find yourself overworking because you feel that you're never coming to the end of a topic. It's because there is no end to the topics. So you have to just learn when to say no and learn where your boundaries are, and make sure you put time aside to have a social life, because when you get to be a senior medical student in your 4th and 5th year, you'll start working full-time placements. You'll have a lot of work to do, and you'll need to know how to have those skills. You need to know how to do those things and deal with quite emotional, difficult situations. So I'd just say, like, in first year, don't overstress and just learn when to say no so that you're prepared for your later years. I have heard, though, that first years this year are really struggling because they are sort of this like COVID generation, I think it's called, where they did their GCSEs and A levels mainly through COVID. And so not that that wasn't difficult for them, but there was a reduction in the expectation that they had because they were going through a difficult situation. So a lot of first years are now struggling with medicine because medical schools stayed open through the pandemic, because we were seen as key workers, we were working in the hospitals. And so the medical schools aren't being quite as lenient. So just be prepared that it might be stressful, but you will make it through and you'll get used to it. But just learn when you've done enough, when to say no. If my BMAT UK is average, but I have high A-level scores and GCSEs, will I receive an interview offer? Usually A-level scores, it doesn't really come into it. If universities only care if you're being predicted their conditional scores or higher, because they don't. So if a university, let's say Manchester, you had to get 3 A's, they don't care if you're going to get 3 A stars. They just like if it's 3As, 3A stars or anything in between, that's all the same to them. So high A level scores doesn't come into it. Some universities look at GCSEs more than others. So if a university does consider GCSEs more, then you have more of a chance of getting an interview. If your UCAT or BMAT's average. If you have a low UCAT or BMAT, then only really consider the universities that really don't look at them, because your GCSEs aren't going to make it up that much in a university that really does care about UCAT. But I know, for example, Manchester, they highly use UCAT and rarely look at GCSEs. So, you know, it kind of just depends on the university again, unfortunately. Can you explain teaching style at Manchester and how you compare it to integrated teaching? Yeah, so Manchester is pure PBL. Manchester was the pioneer for PBL in the UK. I think there's a Canadian and then like a Scandinavian university, and it was them and Manchester that came up with applying PBL to medicine. It's different to integrated teaching because we have a lot less lectures. So we have 6 hours of lectures a week, but other universities have, I think, like up to 20 hours of lectures a week, which is like ridiculous. 6 hours was enough. Manchester, we also don't do any written work. So all our work is spoken. So it's just group work. You have discussions and debates, and there's a tutor there to make sure you're keeping on track, but also to assess that your knowledge is where it's meant to be. So we don't write essays. Integrated universities, they do usually have to do 1 or 2 essays a week. That's what makes Manchester so flexible, because there are no deadlines in theory. You do have to do PBL, but you can do as much Roswell as you want, in theory. But so that's really the difference between a pure PBL and integrated, is just that we have less lectures and less writing stuff. We do have 1 essay a year, to be fair, 1 like research project. And then also we have full body dissection and 2 hours of communication skills each week. And then obviously like ethics teaching and stuff as well. But it's all more practical than being spoken at. It's all sort of situations that you have to get involved in. So that's really the difference, I think. We also have quite early placements in Manchester. But integrated teaching is good as well. I personally don't recommend traditional style. I know that's what you guys will be more used to, but when you are a doctor, when you're sort of a 5th year, and then when you're like in your first few years of being a doctor, the teaching is very PBL style that you will get as a junior doctor. So it's kind of nice to already be used to it, to be honest. But yeah, just basically more practical. Does your answer matter as long as you justify it? I assume you mean like mainly in the ethics questions. As long as you like correctly justify it, no, it doesn't usually matter, unless it has a correct answer. Like, for example, if something is illegal and you say, yeah, that's fine, then like obviously that's not okay. But generally, say a pro and con and then a decision and you'll be fine, and it doesn't necessarily matter what you answer. 8 and 9 is good enough for the top 8 unis. Yeah, there are no really like top unis for medicine, because everyone asks me this about, so when you get to the end of your medical degree, you are guaranteed a job in theory. And what happens is everyone in your like year across all universities are ranked, and then the person at the top gets their first choice of hospital, and then it goes down the list and the hospitals run out of places. But you aren't marked based on how good your university is. It's to do with like how well you did within your university. So there is technically no top unis, and also the GMC makes sure that all universities are at a basic standard. So it's really look at what teaching style you like the look of before you apply, and also what their values are, because it was my opinion before I came to medicine, and even more so now, that to be a good doctor, I didn't need to know everything about the rarest diseases, but I wanted to be a good communicator and be able to be prepared for being a junior doctor. And I think Manchester has done that for me, more so than some of the more prestigious universities. However, the students there are much more like, know the basic science in a lot more detail than I personally would. So it's what you care about more than anything. But 8s and 9s, yes, that's good enough. But yeah, also the top university, the top medical schools in the UK change like every year. The rankings completely change all the time. So it's kind of hard to say which ones are the best. I actually think at the moment Oxford and Cambridge aren't even the top, so it's really strange. I think it's like an Irish university or something, but it constantly changes. Am I in 5th year? Yes, I am now. Almost halfway through 5th year. 5th year starts very early and finishes very early, so yes, we only do 5 years at Manchester. How are interviews scored at Manchester? Where can I find marking or assessment criteria for interviews at Manchester? I assume you mean like how did they score answering the questions? So Manchester really quite heavily care about communication skills. All of their questions like revolve more around like, I'm pretty sure there's a whole station on like what your extracurricular activities were, like if you played any sports or music and things. I'm pretty sure they asked a lot of questions about that from what I remember. So they just care that you're confident, friendly, and just like a basically nice human being, and that you can answer their questions correctly. They want you to know the difference between a PBL university and a different university, because we're so heavily PBL that they will expect you to understand what PBL means and that you are interested in going to a PBL uni. I'm trying to think what else they kind of care about. They do quite a lot of ethics as well. But they're very basic ethics questions from what I remember. So just as long as you get the answers right. And they had no science stations. So yeah, it's just basically scored on how confident you are, how you stay calm under pressure, and just whether or not you feel like a good fit to them. But yeah, be very aware of like having extracurricular stuff if you're coming to Manchester, because they really heavily care about having a work-life balance. They make you do an extra form as well. If you apply to Manchester, you have to do like a second personal statement kind of thing, but it asks you questions like when was the time you worked as a team and things like that. I hope that answered your question. I don't have any more questions in the chat. If you want to ask another question, feel free to. Okay, someone said tweet I did. Yeah, don't worry, I'm not going to leave. I'll give you guys a couple of minutes to type any questions you've got. If you don't have any questions, feel free to leave, and have a nice rest of your weekend and school or whatever it is you've got planned this week. But I will stay for another couple of minutes. So if you've got any questions, just type them in the chat. Oh, okay. That's an interesting question. I wouldn't worry too much about it, because you can't obviously go back and change your personal statement now because you've already applied. I don't think they're really. It depends what universities you apply to. Some of them aren't going to read your personal statement anyway. And the ones that do, they probably won't notice that there's a spelling mistake, and they know that these things happen. Most people who work in medicine have heard of this case. So yeah, I wouldn't worry about it too much. There's not much you can do now. I don't think a spelling mistake is going to be the reason that they would reject you. So basically, don't worry. If I was to choose a firm uni but want to go to my insurance, what would I do? Yeah, so that's fine. What you do is then, like, as quickly as you can, I would say switch them. So you'd have to reject your firm uni, but on the day, providing you've got your grades for your insurance, you can reject your firm uni and accept your insurance. That's absolutely okay. The thing is, your insurance doesn't necessarily like guarantee you a place because you put them as insurance. So if they were full from their firms, then they don't have to take you, I think, but you can reject your firm and you should still get a place at your insurance. But you can do that on the day of results day if you want to. But yeah, you can just reject the firm, accept the insurance. I'm first year medical student at Manchester. Oh, wow. What physiology books would you recommend for year one? The one that I got, I can't remember what it's called. But I don't necessarily recommend it. It's a fine book, but I would say use the website. What's it called? What's it called? Let me just stop sharing, then I will try and find out what the website's called for you. Oh, okay, I've remembered it. So there's a website called Teach Me Anatomy. That's a really good anatomy website. And then they have a website that's called Teach Me Physiology. And that's great as well. And I would use those for first year because it explains it in a really simple way, and you can kind of just Google it and it's free. So that's what we used when I was in my first and second year. I'm trying to think if there's anything else. I did have an anatomy book, but again, I didn't really regularly use it. The better books that I would consider getting as like, if you're going to spend money on a book, is get books when you're in your third year and get like clinical reasoning books to take on the ward with you for like to help you understand the cases. But you're not going to remember your anatomy and physiology like long term. I barely remember, like I know the basic physiology of things, but you're not going to remember the tiny details once you've learned so much that you get to fifth year. So I wouldn't bother spending any money, but Teach Me Physiology was good. And then also a book that's good is like Zero to Finals. They've got a good book. I recommend that, but it's more clinical than physiology. So I hope that makes sense. But yeah, I wouldn't personally, I mean, I can find the textbook for you and tell you which book I bought, but I didn't use it, so I'm not sure I'd recommend it. I hope that makes sense. If anyone else has any more questions, feel free to pop them in the chat. No worries. Yeah, I'll just stay on for another couple of minutes. If you've got any questions, add them in the chat. If you don't, feel free to leave. For interview times, do you mean like times in the day or dates? I'm guessing you mean times in the day. Both. So they usually are midweek. They are I don't think I ever saw any of the weekends. So you have to take time off school for them. Schools usually like are fine with it, to be honest. Mine was okay. And then they usually run from like 10 in the morning till like 3 in the afternoon. That's kind of typical times. They really spread them out more than they need to. There's a lot of like breaks in between and stuff, I remember. And they give you like talks before and after about the university, etc. That was my experience. But what takes the most time is they make you bring like ID and stuff and they check all of that. That takes a lot of time, but yeah. Usually midweek and midday. They give you plenty of time. Which of the 3 interview styles is the hardest and requires the most preparation? It depends what type of person you are. That's really the best answer for that one. Personally, the interview style that suited me the best was MMIs. I didn't sit at either of the others officially, although I did do practice ones with the other ones. I'm the kind of person that if I mess up, I need to just move on and get over it and just move on to the next question. Whereas I think if I messed up a question and then sat in front of the same interviewers, I would struggle to sort of get over it. So I think MMI is better for that kind of reason, but I know some people just warm up to people and prefer to have the same interviewer throughout. The actual question types are not that different, so there's none that requires more preparation. It's more just your mindset going into it and what you prefer. And then group interview, it's not hard, but if you're naturally a shy person, you might struggle more because you might find it harder to talk in that situation. And if you're like an overly loud person, you'll also struggle because you'll get marked down if you're like interrupting people and not delegating properly. But they all have similar questions, so your preparation is more going to be on the type of question than the actual style. The actual style just comes down to what kind of person you are. I don't think Manchester had a group station last year. I didn't have that. I don't think Manchester's ever had a group station, to be honest. I don't think they care. I don't think they even offer like practice PBL or anything like that. But yeah, no, Manchester don't do it. The one that I remembered that used to do it was Hull York, because I knew people who applied there who had to do it. I'd never heard anywhere else do group stations, so I wouldn't really worry about them too much. I think, especially with COVID, they're not gonna do group stations. Oh, Kent and Medway do it. Okay, there you go. I'm not sure. They might be a newer one anyway, so yeah, not that many places do group, and group is rarely like marked harshly from my understanding. If I was late to an interview, should I assume automatic rejection? No, depends how late you are, I suppose. Things happen. Universities are really understanding. This is the thing, like, as I've gone through university, that I understand more and more is like they stress so much, oh, this exam in university, if you're late, you're going to automatically fail it. That is not what happens in real life. I've known people who literally like overslept and missed half an exam, and then they just put them in a different setting. Universities, if something's happened, so let's say your train's been delayed, you're traveling from really far away, or someone's ill or you're ill, you could just get in contact with that university as quickly as you can. They usually give you a phone number. You just need to ring it as soon as you know you're going to be late and let them know, because they might be able to put you in a different date or different time. So it's not automatic rejection. It's only automatic rejection if they can't put you in a different interview. So just have a good reason, I suppose. If you're just like, oh yeah, I slept through and now the interview's over and I'm just letting you know now, then maybe it would be, but let them know quickly and it'll be fine. What is the best way to revise in university? It depends which year you're in and what you're revising for. We have different exams in medical school. We have usually like a multiple choice exam and then a practical exam, and then there are other things you have to do like portfolio and research kind of essays as well. In terms of revision for your practical exams, it's just like know your examination techniques and practice it on other medical students so that you get slick and manage your time well, because that's what people fail. That's why people fail, because they don't manage their time. And then in terms of like the multiple choice question exams, you don't really need to revise for them in first and second year. Generally, just watch the lectures and generally have been working hard. And then for third to fifth year, I recommend there's a like website called PassMed, or Past Medicine, I think is its full title, but we all call it PassMed. And it's got questions like the questions you're asked in the multiple choice exam, and you can just like practice those little and often, and that's the best way to revise, because like when you get to your fifth year, there's no way you can actually go back and revise all the topics you've covered, but that you can just keep up to date with like different topics, I guess, and that explains why the answers are the answers, if that makes sense. So like if you got the answer wrong, it'll say no, this is the answer because of this, and it's a good way to like revise, I think. Apparently you can get it free through university, but only for a couple of years, and then you have to pay, but it's not a ridiculous amount, so I recommend PassMed. And it's good for like SJT and stuff when you come to fifth year and you have to sit those exams as well. How online MMI is structured, so it's exactly the same as in person, you have like however many stations it is, 9 stations or whatever the university chooses, and you get put into like a breakout room. From what I remember, you get put in a breakout room, and then when the interview is there, you move to the breakout room of the person who you're meant to be interviewed by. So it's just like on Zoom usually, or on Teams, and then you just get put in different rooms. And then they just ask you the questions and you have to answer them. It's exactly the same as face-to-face. Can you transfer universities? No, I don't think so. You can drop out and apply to a different university if you want to. I know people who dropped out of medicine because it wasn't for them and moved to different universities because they wanted to be close to home. But you can't just switch and stay in the same year. You always have to start again, I think. I've never heard anyone do it though. It doesn't really matter what university you go to because all medical schools are good medical schools, and you're so glad to be in medicine that you just accept that that's where you're going to be for 5 years. You can't guarantee where you're going to be after university. Like I see so many people who are like, but I want to stay in London for the rest of my life. You're not guaranteed to go to London after university. It's quite difficult to get into. So just like accept wherever you end up and just try and enjoy it as much as you can. And it's only for 5 years and it will go really fast. If I'm too shy or nervous in an interview, would that be a turn off for the interviewers? Yes and no. So interviewers always know that you're going to be nervous, and so do accept that you're not going to be as slick as you might be, like if you were just doing it with friends. So it's fine to be nervous. It doesn't, that's better than being cocky, but try and be as confident as you can, because if you're not clear in your answers, if you're not, like, if you look like you don't believe what you're saying, then they'll take that to mean that you don't believe what you're saying. So you just kind of got to be confident in your answers, even though you'll be nervous in the situation. It's a technique you kind of have to learn, because in medical school in medical school exams, you do get marked down for being like not confident in your exams. You get points knocked off. And obviously, like in placement, you got to be as confident as you can. So just like try and practice as much as you can so that you can at least pretend to be not nervous, I guess. But we do know that people get nervous, and that's not the end of the world. Just be confident in your answer. I'm glad it's been helpful, and good luck with your journeys to become a doctor. I suppose mine's a lot shorter than your guys. I've got to pass one more lot of exams. But when you guys get to medical school, you'll find it goes so quickly, and you'll be at the end of your journey within like a click. Any more questions before we log off? If not, good luck and feel free to leave. No worries. Good luck with everything. Any more questions from the last 5 before I shut down the Zoom? Right, one more minute and then I'll just turn the Zoom off, guys. Okay. Are there world-class teachers in all medical schools? Depends what you mean by world-class. There's the same level of teachers at pretty much all medical schools in my experience. Medical school teaching, it's a bit different to other degrees because yes, there are like these crazy teachers in other degrees. Like I know Manchester has Brian Cox as their like physics lecturer, but it's different in medicine because your teaching is going to be done by people who are doing world-class research at your university, and then also by real life doctors. And real life doctors have spent their whole life dedicated to medicine. So you might not be a world-class doctor, but you're still a very good doctor. So to be teaching at a medical school, you have been a doctor for a long time, and then also done like teaching training, etc. So they are all brilliant teachers. You also, in your first and second year, you're not exclusively taught by doctors. You are taught by people who are experts in those subjects. So let's say you're doing like an immunology lecture, it will be an immunologist, not a doctor, who's doing that lecture. But they're all very good, and the curriculum is the same in all medical schools, so you're all being taught the same thing. And anywhere you go, you're going to have lecturers you like more or less than each other. So it isn't necessarily that there are bad teachers anywhere. But I would say the course is slightly different. So like in Manchester versus like Cambridge, they go into a lot more detail than they do in Manchester. So it's not necessarily like detail you need to be a good doctor. It's just more science detail. They just prefer it because most of their students are going to go on to do like more researchy based specialties, whereas Manchester's going to be the sort of maybe more friendly based specialties. We still do a lot of research and you still have a chance to get published at all universities, but it's there's just like a slight preference towards different areas of the curriculum in different places. But yes, they're all brilliant teachers in all of the medical schools, but I wouldn't necessarily call them world class in the nicest way possible. Have you got any more questions? Any more questions? Right. If not, please feel free to leave and then I'll know that you're not about to type or anything. What is my favorite thing about studying medicine? I like that it's different all the time. I like the like social aspect of it. Like you get so close with other medical students because you naturally go through difficult things, and I have seen some unpleasant things, but the people who you go through these things with, they become like your family, and I really enjoyed the sort of really supportive atmosphere, and your seniors are always really supportive of you. Like I think in a lot of like other environments outside of medicine, it's very much like if you're higher than someone else and you just talk down to them, whereas in medicine it's very like supportive. which I enjoy. And yeah, the social aspect of it, and also the patients, just like getting to meet people every day and getting to do exciting new things all the time. I really enjoy that. Yeah, I think that makes up for, I just like enjoy the subject honestly as well. I couldn't see myself doing anything different. I'm not like a desk kind of gal, but obviously there were like really difficult parts of it as well. But yeah, I just think it's quite fun and different and very hands-on and practical, especially in your later years. This year's been my favorite year that I've done so far, just because you're trusted with more and able to actually get really stuck in. First and second year were a bit boring to me, but yeah. Any more questions? If you don't have any more questions, please feel free to leave. I'm just giving you another minute or so to type anything you need to type. I'll just give you one more minute to answer and to ask any questions. If not, I'll just close the Zoom and you can leave. How much space do you have in your accommodation? So I've not lived in accommodation since my first year. In my second year, I lived in a student house, and then ever since then, I've lived in a flat near the hospital that I work at, because I don't live, because my base hospital isn't in the centre of Manchester, it's in Salford. So I live in a flat now closer to the hospital so I can save on travel. But my accommodation was quite big. It was very old fashioned and had rats in it. It was horrible. Accommodations these days are generally pretty good. You get a room and you're in a flat of anywhere between 4 and like 10 people. I was in one with 10 people, and you have a kitchen between you and usually like a sitting room between you that has like a couple of settees, and that's pretty much it. It's a reasonable amount of space to keep stuff in. Yeah, it's not too bad, honestly. You get used to living in kind of gross accommodation, in my opinion. But most people move out of it after first year. They usually live with friends in a house in second year, and then whatever in third, fourth, and fifth year, whatever they want to. Also, you get accommodation in the hospital if you're like based in a hospital that's really far away from your university. So for example, I'm based at Wigan in a couple of weeks' time, which is quite far from Manchester, like relatively far from Manchester. You get given accommodation in the hospital as well in your like last couple of years when you're like on full-time placement. And that's horrible. It's not good accommodation. It's tiny, it's cold, it doesn't have Wi-Fi, and but it's a bed and you live with it. Really. But yeah, don't worry about accommodation. Honestly, people stress so much about it, but no student accommodation is good. And it's just like more bad than other accommodations. Just like get one that's in your budget range, and wherever it is, you'll get used to it and it'll feel like your little home. They'll be fine. Do you have any more questions? Because I'm happy to stay on and answer as many questions as you have. If you genuinely don't have any questions, can you please leave? Because I don't want to end this before you've asked all your questions. I'm not trying to get rid of you, but just so I know. Right, brilliant, thank you. If you do have any more questions, I'm absolutely happy to answer them. It's just helps me know. Right, Jonathan, I'll give you 1 more minute to answer any questions you've got. Ask any questions you've got. I don't know why I keep saying answer. And then I'm going to end the Zoom. If you don't have any questions, please feel free to leave and enjoy your Sunday. Okay, Jonathan, I'm going to end the Zoom now. So if you have any more questions, there are more surgeries coming. You feel free to ask any then, or get in touch with 6 Med. So good luck with everything.